Hello, I'm Dr. John Michaelos, and this is a Q&A. Virtual reality headsets are also changing the way we do our daily lives, and they are helpful. My mother actually wears them because of her macular degeneration. It gives her abilities to see better than she's able to see without them. And at this point in time, I don't know that there's anything that's dangerous about them from an eye standpoint. And obviously, you're seeing a virtual world, not a real world, so I would just be careful in navigating your environment with them in place. So how safe is LASIK compared to even just 10 years ago? Well, technology continues to improve, and so the LASIK that we do today is far more safe than it was previous. Just a decade ago, most people were cutting the eye with a blade to do LASIK surgery. Today, most everybody is using a laser to create that same LASIK cap. So LASIK has become much more efficient, much more reliable. It's far safer than even wearing contact lenses. Are there new technologies that can replace glasses and contact lenses? Today, glasses and contact lenses is becoming a thing almost of the past. There's a lot of patients that if they wish their vision to be made better, can do it via either LASIK surgery, clear lens exchange, or cataract surgery. So wearing glasses in the future may be a thing of the past. Lash extensions, can they be problematic? They can be problematic from a medical standpoint, and especially in overall health to the eyes. When they place eyelash extensions on the eye, some are glued in place, some are even actually sewn in place. And what's happening is you're putting something artificial around the lashes that stays there for a period of time. Our eyelashes have a function to them, and their functionality is to clean the air in front of the eye. So it's just like your air condition filter, and they also need to be cleaned just like your air condition filter. However, when you have eyelash extensions in place, people usually avoid cleaning their lashes because they don't want their lashes to fall off. And that's how a lot of eye infections can happen. So eyelash extensions can be problematic, and they should not be worn for extended periods of time. How to improve festooning? That's puffiness to the lower lid, or even bags on the lower lid. And I have patients that come in all the time because they first think that the lid looks more dark, and they don't like the appearance of the sag or the puffiness. So eyelid puffiness can be helped with topical creams and also laser and surgery. Topical creams that are available, most all of them will help reduce the puffiness, but it will always come back. There are lasers that can tighten the lower lid skin, and there's even surgical procedures that can be done as well. The discoloration, it's actually not discoloration of the skin, it's a shadowing effect that makes the skin look darker on the lower lid when the lower lid gets puffy. How close are we in genetic testing to help us with eye conditions? We're already doing that for certain eye conditions like retinitis pigmentosa. And so that is what is on the forefront, and there are a lot of institutions currently researching that, and I think we will make a lot of headway over the next 10 years. Is it bad to clean your contact lenses with tap water? And the answer is yes, it is. You should never clean your contact lenses by putting them in your mouth to wash them off, or by using tap water. All of those things are extraordinarily dirty. It'd be best to throw the contact lens away. Contact lens wearers should always have their glasses with them. So in the event your contact gets damaged or comes out and there's not an appropriate way to cleanse them with contact lens solution, then keep the contact out, put your glasses on. Do eyes really get sunburns? The eyes are sensitive to the damaging rays of the sun. And there are things that can change on the surface of the eye. It can make the eye drier. It can also cause different problems of the eye. You can have a growth of the eye called a pingueculum or a pterygium, where the tissues grow way faster than what they're supposed to, and they can opacify, and they can actually affect the overall vision. You can also get skin cancer in and on the eye. So it's extremely important to wear the proper eye protection when you're outdoors. And it's a wives' tale that windows protect you against the damaging effects of the UV. So even if you're at a window inside, that can still cause harmful rays to hurt the eye. Can your eyes get stuck if you cross them for too long? People often ask, can your eyes stay crossed if you cross your eyes on purpose? And the answer is no. If you don't have a weak eye crossing your eyes, there's no way to cause that to stick that way. But you shouldn't do that because you'll see two of things and you'll drop something. So don't cross your eyes. Can crying change your eye color? Well, when we're tearful and we're crying, it creates a lot of hormonal response in our body when you're crying. And so your eyes can frequently become a little bit red. That red can contrast with the overall color of your eye and make it appear falsely a different color. But you can't change your eye color, the color of your iris, by crying. Why are some babies born with blue eyes that eventually turn brown? Well, they're born with less pigment of their iris. That's the structure inside the eye that has the color differentiation. And as they mature, there's more pigment that gets deposited, which causes their eyes to become more brown. So not uncommon for newborns to have blue eyes that change color as they mature.